What I like the best is we get to really get to focus on the right thing for the right reason.
It's really us taking a systematic approach at looking at our processes that we have both internally and externally throughout the organization.
The doctors here, they're really professional. They're not on a level of they're up here and you're down here or you're a number.
The move towards value-based care is definitely a move from the art of medicine to the science of medicine. The decision process for adopting a value-based care didn't happen overnight, but I would say it happened fairly quickly. There were several realizations, several points of intersection, several data elements that were coming all together that allowed us to start thinking differently and to realize that the current system of healthcare is unsustainable.
So I work as an inpatient physician, as a hospitalist, and we are very much dependent on analytics. I think all of us as physicians think we're always doing the right thing 100% of the time. It's always a little bit surprising when you see, the percentage that you're not hitting the mark 100%, and being able to kind of be exposed to those analytics and being presented with the numbers on a regular basis allows you to kind of improve your care significantly.
Analytical software has helped us tremendously in many of the things that we're doing with quality improvement throughout the organization. We use Optum One to identify patients who have gaps in care.
The Optum Analytic Platform has really grown up with our ACO. We were one of the fairly early adopters of the platform, and we've been able to work with Optum to connect to our electronic medical record, to mine our data, to develop various cohorts of patients.
Hello.
The platform has allowed us to produce standard reports that we report routinely in a transparent format, and it's helped us achieve, especially in our quality measures, using very little resources other than the standardization, the belief in the data, and the transparent method for which it is distributed. We're very proud of our results in our accountable care organization. We've been able to achieve some really dramatic improvements in areas of cost and quality. Specifically, one of the areas that we're most proud of is the fact that our ER visits are 44% less than the ACO benchmark in the country. Our admissions per thousand are 25% less. One of the ways that we've been able to have such success in our clinical research program is because of the Optum One platform.
In Wilmington, here at PMG and Wilmington Health, we're kind of set up for success for a bunch of different reasons. We have a robust electronic medical record that allows us to query the data. So I've been doing research for about 7 years, and in that short duration, I think we have been part of some significant successes.
One success story that I've seen personally was Miss Fowler's story. She came here for a cholesterol study, hoping to, get that down below the 200s. But we also found something that otherwise wouldn't have been caught in time. We actually found a rare form of cancer, and we were able to send her out to a treating physician and get it treated, and she's in remission. So otherwise the cancer wouldn't have been found without us working with her.
If it was not for PMG, I would not be sitting here talking to you guys.
We interact with the doctors daily. I mean, a lot of the doctors we're calling, text messaging, emailing multiple times a day.
Having a coordinator gives me the feeling of having someone there for me, which makes it easier because diabetes is such a hard disease, and you can feel alone.
I see the prism, of what I do from a clinical research standpoint, how well it works, from a triple aim standpoint. As we develop more analytics and more tools and better ways to measure that as we progress, then it's going to be, I think, demonstrated better and better.
The move to value-based care is a cultural transformation because it's dramatically different than the way most of our physicians have practiced for most of their careers. We've learned a number of lessons on this journey. You know, the advice I would give to anybody that wants to pursue this journey is to start soon. It's never too early to start. And start slowly, and understand that this is going to be the journey that you're on for the rest of your career, and is going to be the pathway that your organization follows from this point forward.